challenge was a study in colon cancer patients looking at whether a structured exercise program could not only improve quality of life and function, but more importantly, survival. So it was a phase 3 randomized controlled trial, and colon cancer patients that had had surgery, had completed adjuvant chemotherapy, were then randomized to either a group receiving health education materials, which said, go and exercise, eat healthy. And then the other group, as well as getting that education material, had a 3-year structured intervention. And the intervention was to get them exercising, but a really integral part of that was a behavior change component. So initially, they were seen at least every fortnight, but that decreased over time. Initially face to face, later it could also be done via some form of telehealth.
And if I can just jump in and say, when we talk about behavioural counselling, we're really talking about an approach that was very targeted at helping people identify what their barriers were to exercise and overcoming those, and making sure that the exercise was tailored to those individuals and their preferences and what they enjoyed, so that it would increase the likelihood of them exercising.
Well, the results were extremely interesting and very positive. So, our primary endpoint was disease-free survival. And what we found was that in the exercise group, this was 80% compared to 74% in the non-exercise group. So that actually equates to like a 28% risk reduction in the cancer coming back or developing another new cancer. So that was pretty spectacular. Um, and then we looked at overall survival, which was a secondary endpoint, and we looked at like 8 years, and the survival was 90% in the exercise group compared to 83% in the sort of control group. And that equates to a 37% decrease in risk reduction.
The implications for patients really are that exercise needs to be considered as part of their cancer treatment, and we're really talking about exercise which is equivalent to meeting current guidelines or just exceeding those. So that equates to a brisk walk 4 to 5 times a week for about 45 minutes. And these things are things that people can do. We were very focused on aerobic exercise in this population. So there are obviously guidelines that relate to resistance training and balance training in people as they age. But our results really demonstrate that focus on aerobic exercise. So, walking, swimming, cycling, those kinds of things which get your heart rate up and get you breathing harder are really important in terms of managing risk of recurrence and overall survival, and just generally making people feel better.
This was a landmark study because it was the first randomized controlled trial that was actually powered to show a difference for survival. So prior to this, from as early as about 2006, 2007, there were some big observational studies that were starting to show a benefit for exercise, probably for survival. But of course, any observational study has inbuilt a lot of problems with it. And even though they adjusted for things like BMI, whether the person smoked or not, etc., maybe there's something different about those who exercise and those who don't, or so this was a randomized controlled trial. And we had 898, I think was our final number, patients on it. And we had very long follow-up on them. So we really, for the first time, were powered to be able to show that there was a difference in survival.
So I think that, the first and at this stage, the only large-scale randomized trial in oncology around the world that's demonstrated a survival benefit from exercise, just really, drives home the enormity of the impact. And to be fair, it's unlikely that a study like this will be done again. And so we really need to maximize the way that we're using this data to inform clinical practice going forward.
I think the really important thing is we have to put this into practice. The sort of figures that we're showing are equivalent and often better than what you're getting from expensive chemotherapy agents. Now, we're not for a second saying that people should not be having chemotherapy, but as Haryana said, this is an adjunct treatment. So if this was a drug that Haryana and I had managed to come up with and we showed this sort of benefit, we would have the oncologists and the community, everybody else knocking on the door of the PBS and saying this drug must be funded because there's such a huge survival benefit. Well, guess what? It still needs to be funded, but not as a drug through the PBS. But clearly, we need, the study showed that just telling people to go out and exercise is not enough. And we need to be providing them with a prescription of exercise that's individualized. But more than that, we need to be facilitating them able to do that. And in particular, bringing in the behaviour support program so that people are helped to incorporate exercise into their everyday life.
Mhm. Yeah, and I think the other thing is that, we've kind of talked about the main results of the study. There are a whole range of other outcomes that we're looking at with the data. So there will be cost effectiveness data that will be published. We'll be looking at, what the optimal dose is and the predictors of adherence to the exercise program in the people who received it, and also biomarkers. So we have data we've collected biospecimens so that we'll be able to explore some of those mechanisms that might be underpinning the action of exercise on cancer recurrence and survival. So those things are all really, important additional outcomes from the study that will come out over the next couple of years. I think personally, once we have the cost effectiveness data, then we really need to be making a case to government, to the health minister, that accredited exercise physiologists who are trained to work with people with cancer be funded to provide this kind of structured exercise program in the early survivorship phase, and then providing support to them beyond that.
So the study was in colon cancer patients, and clearly that's what we can give very strong, robust evidence for. But it is likely that the impact would also be seen in other tumour types. And one of the things that leads us to suggest that is that when we looked at whether for cancer recurrence, we also looked at whether new cancers had come back. And one of the interesting things was that there was a decrease in the number of people developing breast cancer during the follow-up and also prostate cancer. Now, the numbers are small, but there's certainly a suggestion there that this goes beyond just colon cancer. And I suspect that when we look at the mechanisms, it will be much broader. So I think we can acknowledge that the data is there for colon cancer, but it's highly likely that this also would benefit people with other tumour types.
This was a study that involved 889 participants globally, recruited from 55 centres. So it's a massive undertaking, and there were many, many hundreds of people involved in the study. Particularly wanted to acknowledge the Canadian Cancer Trials Group, which was the lead organisation who ran the study and led it globally. But in Australia, we were funded by the National Health and Medical Research Council, and we had the study was a POCOG supported study, and it was endorsed by the Australasian Gastrointestinal Trials Group as well. We had in Australia at the peak, we had 25 centres participating, and that involved oncologists, study coordinators, physiotherapists, and exercise physiologists around the country. And of course, we would not have been able to do this without the generous participation of the 889 people who had been diagnosed and treated for colon cancer who agreed to take part.